I'm Dr. David Marais, head of the Lipid Clinic at Groote Hospital and of the Lipid Laboratory at the University of Cape Town. The risk of disease is decided by examining the lipid profile. The lipid profile is ideally done in every young adult to determine whether there is significant disorder and whenever any risk factor is present for heart disease, either in the person or in the family. The lipid profile that is used in conventional medical practice would include a fasting triglyceride, total cholesterol, HDL cholesterol, and LDL cholesterol. Occasionally in medical practice, there's also the need to assess apolipoproteins A and B for HDL and LDL respectively, and lipoprotein a, which also has a bearing on heart disease. Specialized centers do more detailed tests, which involve ultracentrifugation for lipoprotein characterization, electrophoresis that can separate various lipoproteins, and enzyme and cell studies for unusual disorders. Genetic tests can also be done to define some of the inherited disorders. On a usual fasting lipid profile, one would ideally have a triglyceride of less than 1.7 millimoles per liter and a total cholesterol of less than 5 millimoles per liter. The total cholesterol is better understood by looking at the particles separately, such as LDL, which ideally should be less than 3 millimoles per liter, or HDL, which ideally in men should be more than 1.2 millimoles per liter, or in women more than 1.4 millimoles per liter. Overall, the lipid profile reflects both the environment in which the person lives and includes the effects of lifestyle and the genes which the person has inherited and other diseases that may be present. The lipid profile is distinctly influenced by the diet. Not only do the lipids pass through the blood after the meal, but the nature of the fatty acids will influence the vascular disease as well. It is always thought that only high levels of lipoproteins can cause disease, but in certain instances, very low levels can also be associated with disease. A full understanding of the lipid profile is necessary to assess risk and to monitor the management of dyslipidemia.